Parkinson's disease is a neurodegenerative condition that occurs due to degeneration in the basal ganglia and it affects movements mainly. It's the symptoms vary from very person to person and its severity also vary from person to person. Today I'll be talking about few of the symptoms in general. Number 1, tremors. That is very slow to and fro or rolling kind of movements in the hands, especially during the rest. It is also known as the resting tremor. Bradykinesia. Bradykinesia is the slowness of the movements. That is whichever activity they are doing, it's very slow. That if they are walking, if the movements are very slow. If they are lifting something, it's very slow. If they are trying to speak something, the words come out very slow. So bradykinesia. Next is muscle rigidity, that is stiffness in the muscles, and that leads to joint stiffness. That means whatever the activity they are doing, the movement is very stiff. Number third is postural instability. That means their balance, overall the body balance and stability is disturbed. They have the very increased risk of fall. They fall very often. Next is incoordination. That is the coordinated movement. Like if they are writing something, it won't be proper. If they are buttoning the shirt or if they are doing very fine motor skills, it will be very difficult for them to perform. Next is speech disturbances. Their speech, as we have talked about bradykinesia, due to that only their speech is disturbed. Speech is slurred and there is lack of facial expression. They have a mask like face. Their expressions are almost nil. They will have a face which have no expression. Next one is freezing of gait. That means they will just freeze. If they are walking, and something comes in front, they will just stand still. That is known as freezing, and it's one of the major severe of symptoms which can lead to major accident also and fall also. Next one is loss of smell. There's a lack, slowly the smell sense is lost. Non-motor symptoms includes Non-motor symptoms includes depression, anxiety, constipation, lack of sleep. As I have already said, the symptoms vary from the person to person, and severity of symptoms also vary from person to person. So it's better when it's diagnosed early, you start the treatment early along with the physiotherapy sessions, as physiotherapy play a very important role in management of Parkinson's and its symptoms.